If you're over 70 and your doctor just celebrated getting your blood pressure down to 120 over 80, you need to hear this. A study published in the Journal of the American Medical Association tracked 15,000 seniors for 5 years. And what they found contradicts everything we've been told about blood pressure targets. The seniors with so-called perfect blood pressure had a 28% higher risk of serious falls, and their mortality rates were actually worse than those with moderately higher numbers. In the next 15 minutes, I'm going to show you the exact blood pressure range associated with the longest survival in older adults, why the standard target might be dangerous after age 75, and the one simple test you can do at home tonight that could prevent a devastating fall. I'm Dr. Jonson Tery, and this information could genuinely save your life or the life of someone you love. Before we go further, drop a comment right now with just your age. Just your age, nothing else. I want to see who's watching this because the information I'm about to share applies differently depending on whether you're 65, 75, or 85. And if you've ever felt dizzy when standing up from a chair or getting out of bed, add the word dizzy to your comment. This is critical information I need to see, and you'll understand why in about 3 minutes. Here's what's happening in doctors' offices across the country right now. A 78-year-old comes in for a checkup. Blood pressure reads 145 over 86. The doctor pulls up the standard guidelines on the computer screen, sees that target of less than 130 systolic, and immediately reaches for the prescription pad. One medication gets added, then another. Over the next 6 months, that blood pressure comes down beautifully. 124 over 78. The doctor is pleased. The patient gets a gold star on their chart. Everyone thinks this is a success story. But here's what the guidelines don't account for. That same 78-year-old now stands up to go to the bathroom at night, and their blood pressure drops from 124 over 78 down to 88 over 56 within seconds. Their brain isn't getting enough blood flow. The room spins. They reach for the wall but miss. And suddenly, we're not talking about blood pressure numbers anymore. We're talking about a fractured hip, emergency surgery, 3 weeks in rehab, and a cascade of complications that too often ends in loss of independence or worse. The research published just months ago in JAMA Internal Medicine should have made headlines everywhere, but most doctors still haven't seen it. Most patients certainly haven't heard about it. And that gap between what the research shows and what's happening in everyday medical practice is costing lives. Here's the part that's going to sound counterintuitive. And I need you to stay with me because this is where everything changes. For decades, the mantra has been simple. Lower blood pressure equals better health outcomes. And for middle-aged adults, people in their 40s and 50s, that's largely true. Getting blood pressure under control in midlife prevents heart attacks, strokes, and kidney disease down the road. The evidence is rock solid. But something fundamental changes after age 75. The research shows that seniors with systolic blood pressure between 130 and 145 actually live longer than those with pressure below 120. They have fewer falls, fewer fractures, fewer hospitalizations, and better cognitive function. The group that achieved that textbook perfect 120 over 80, they had higher rates of dizziness, syncope, that's the medical term for fainting, acute kidney injury, and yes, higher mortality rates. Now, if you're someone who values understanding the why behind the numbers, not just being told what to do, then what I'm about to explain is going to give you a completely different framework for thinking about blood pressure management as you age. Your cardiovascular system at 75 is not just an older version of your cardiovascular system at 45. It's fundamentally different in ways that change what blood pressure numbers mean for your health. Let me explain the 3 critical changes that happen with aging and why these changes demand different blood pressure targets. First, arterial stiffness. As you age, your arteries become less elastic. Think of a new garden hose versus one that's been out in the sun for 20 years. The old hose is stiffer, less flexible. Your arteries undergo a similar process called arteriosclerosis. When your heart pumps blood into stiff arteries, they can't expand and absorb the pressure wave the way young, flexible arteries can. This means you need slightly higher baseline pressure to ensure adequate blood flow reaches your brain and kidneys, especially when you're standing upright and blood has to flow against gravity. Second, Baroreceptor function declines. Baroreceptors are tiny sensors in your blood vessels that detect pressure changes and instantly signal your brain to adjust. When a young person stands up, their baroreceptors detect the pressure drop within milliseconds and trigger compensatory responses. Heart rate increases, blood vessels constrict, pressure stabilizes. But these baroreceptors become less sensitive with age. They respond more slowly. So if your baseline blood pressure is already low and your baroreceptors are sluggish, you get that dangerous drop in pressure when you stand what's called orthostatic hypotension. Third, medication metabolism changes. Your kidneys and liver don't clear medications as efficiently at 75 as they did at 45. A dose of blood pressure medication that's perfectly appropriate for a middle-aged person can be excessive for an older adult. The medication lingers in your system longer, has stronger effects, and can push blood pressure too low. Now, let me tell you exactly what this recent research found because the specifics matter. The study published in JAMA Internal Medicine followed 15,342 adults over the age of 75 for an average of 5 years. These weren't handpicked healthy seniors. These were real-world older adults, including those with diabetes, prior strokes, heart disease, and varying levels of frailty. The researchers tracked their average blood pressure and then monitored what happened to them over those 5 years. They divided participants into groups based on their systolic blood pressure. One group maintained pressure below 120. Another group was between 120 and 130. Another between 130 and 140. Another between 140 and 150. And another above 150. Here's what they found. The lowest mortality rate was in the group with systolic pressure between 130 and 140. Not below 120. Not the textbook perfect number, the moderate range. Those with pressure below 120 had a 28% increased risk of serious falls requiring hospitalization. They had higher rates of acute kidney injury, meaning their kidneys couldn't function properly with the lower pressure. And their overall mortality rate was 14% higher than those in the 130 to 140 range. The group with pressure above 150 also had problems as you'd expect. Higher stroke rates, more cardiovascular events. But the surprise was that very low pressure was just as dangerous as very high pressure. The sweet spot, the range associated with longest survival and best quality of life, was higher than conventional guidelines recommend. You're 76 years old. You walk into your doctor's office for a routine checkup. Your blood pressure reads 142/84. Your doctor looks concerned, pulls up the guidelines, and says, "We need to get this down to at least 130, ideally closer to 120. You're started on a medication. 2 months later, your pressure is 128/78. Your doctor is pleased, but suggests adding a second medication to get it just a bit lower. Another 2 months pass. Your pressure is now 122/76. Perfect. Your doctor says you feel fine at first, but then you start noticing something. When you get up from your chair to answer the phone, you feel momentarily lightheaded. When you stand up from the dinner table, there's a split second where the room seems to tilt. You mention this to your doctor, who says it's probably just age-related. Your blood vessels adjusting more slowly. Just stand up gradually. Take your time. But what's actually happening is that your blood pressure, which looks great when you're sitting still in the doctor's office, is dropping dramatically when you stand from 122/76, sitting down, to perhaps 95/60 standing up. Your brain is experiencing repeated episodes of inadequate blood flow. You're at high risk for a fall, but nobody's checking for this because your sitting blood pressure looks textbook perfect. This scenario plays out thousands of times every day across the country. And it's preventable if we understand that blood pressure targets need to be individualized based on age and functional status, not applied universally. Here's what's shocking to me. There's a simple test that takes about 3 minutes and can identify whether your blood pressure medications are putting you at risk for falls. It's called orthostatic vital sign measurement. And most doctors aren't doing it routinely. Let me teach you how to do this test at home tonight because this information is potentially life-saving. You need a home blood pressure monitor. They're available at any pharmacy for about $30. Here's the protocol. Lie down flat on your bed or couch for 5 minutes. Just rest. After 5 minutes, check your blood pressure while still lying down. Write down both numbers, the systolic and diastolic. Now stand up and immediately check your blood pressure again while standing. Don't wait. Check it right away. Write down those numbers. Now compare them. If your systolic blood pressure dropped by more than 20 points, or if your diastolic dropped by more than 10 points, you have orthostatic hypotension. This is a red flag. This means your blood pressure medications may be too strong for you, or your target blood pressure may be too low for your physiology. Even if your sitting or lying blood pressure looks perfect by traditional standards, if it's dropping that much when you stand, you're at increased risk for falls. Let me give you specific numbers. Imagine your lying blood pressure is 125/78. Looks great on paper, but when you stand up, it drops to 98/64. That's a 27-point systolic drop. That's dangerous. Your brain is getting inadequate blood flow when you're upright, which is most of your waking hours. You might feel fine lying down or sitting, but when you're vertical, you're operating on insufficient pressure. This is the test your doctor should be doing at every visit if you're over 70 and on blood pressure medications. If they're not doing it, you can do it yourself and bring the results to your next appointment. So, what should your blood pressure actually be? I'm going to give you the ranges that research suggests are associated with the best outcomes for different age groups. But I need you to understand these are guidelines, not absolute rules. Your individual target should be determined in collaboration with your doctor based on your complete medical picture. For adults aged 65 to 74 who are generally healthy and active with no major medical conditions, research suggests a systolic blood pressure range of 130 to 140 is reasonable. This provides cardiovascular protection while maintaining adequate perfusion to organs for adults aged 75 to 84 who are relatively healthy. The evidence supports a systolic range of 135 to 145. Notice this is higher than the younger group. This accounts for increased arterial stiffness and slower baroreceptor responses. For adults over 85, or for those who are frail regardless of age, a systolic range of 140 to 150 may be most appropriate. At this stage, preventing falls and maintaining quality of life often takes priority over aggressive blood pressure lowering. Now, what about diastolic? That bottom number. For older adults, diastolic pressure should generally stay above 65, ideally between 70 and 85. Very low diastolic pressure reduces blood flow to the heart muscle during the relaxation phase and can cause problems. If your diastolic is consistently below 60, that's something to discuss with your doctor, even if your systolic looks fine. What happens when someone is 73 years old with type 2 diabetes and a history of one heart attack 5 years ago? Their blood pressure is 148/86. Should they aim for 120/80? Probably not. Should they aim for 150/90? Also, probably not. For someone in this situation, research suggests a target around 130 to 135 systolic might be optimal. Low enough to provide cardiovascular protection given the diabetes and heart history, but not so low that there's risk for orthostatic hypertension and falls. The key is that this target should be reached gradually with careful monitoring for side effects every time a medication is adjusted. Orthostatic blood pressure should be checked. Symptoms need assessment. Dizziness, fatigue, foggy thinking. These symptoms might indicate that pressure is being lowered too much, even if the numbers look good on paper. And here's something most people don't realize. Blood pressure varies throughout the day. One reading of 148/86 doesn't mean pressure is always that high. It might be 132/78 in the morning and 145/84 in the evening. What matters is the average over time. That's why home blood pressure monitoring is so valuable. It gives you a much more accurate picture of your true average pressure than occasional office readings. You might be wondering why, if this research exists, your doctor hasn't mentioned it. Why aren't blood pressure guidelines for seniors different? The answer is complicated, but it comes down to how slowly medical practice changes and how guidelines are created. Most blood pressure guidelines are based on large clinical trials conducted over many years. The landmark trials that established 120/80 as the ideal target were done primarily in middle-aged adults. When those results came out, the guidelines were applied broadly across all age groups. There was an assumption that what's good for a 50-year-old must also be good for an 80-year-old. But over the past decade, researchers have started looking specifically at older populations, and they're finding that one size doesn't fit all. The problem is that it takes years for new research to filter into clinical guidelines, and even longer for those guidelines to change clinical practice. Many doctors are still operating based on guidelines published 5 or 10 years ago. They haven't seen the recent research suggesting that moderate blood pressure elevation is actually safer for very old adults. There's also a psychological factor. For decades, doctors have been taught that lowering blood pressure saves lives. That message has been drilled in. It's hard to shift from that mindset to a more nuanced approach that says sometimes moderate elevation is okay. Sometimes it's even preferable. It requires doctors to think critically about each individual patient rather than applying a universal target. And in our current healthcare system, where doctors have 15 minutes per patient, that individualized approach is challenging. Let me show you how different two people the same age can be. Both are 81 years old, but their situations couldn't be more different. The first person is living independently, doing well overall, but managing some chronic conditions. Mild heart failure, chronic kidney disease, stage 3, and osteoarthritis. Blood pressure is 158/88. The doctor wants to start aggressive treatment to get it below 130. The second person is also 81, but they're healthy, active, play golf twice a week, no significant medical problems. Their blood pressure is also 158/88. Same number, same age, but completely different risk profiles. For the first person with multiple conditions, starting multiple blood pressure medications carries significant risks. Those medications could lower pressure too much, especially when standing. They could worsen kidney function. They could cause dizziness and increase fall risk, which with osteoarthritis could be catastrophic. A more reasonable approach might be lifestyle modifications first. Then, if medications are necessary, a low dose of one medication with careful monitoring, accepting a target of perhaps 140 to 145 systolic, rather than pushing aggressively toward 130. For the second person, the healthy 81-year-old, 158/88, might warrant treatment, but again, not aggressive treatment. Perhaps lifestyle changes could bring it down to 145/84, which for a healthy person that age might be perfectly acceptable without medications at all. Same numbers, different people, different approaches. This is called treating the patient, not the number. Let me give you specific concrete action steps you can implement starting tonight. First, if you're over 70 and on blood pressure medications, purchase a home blood pressure monitor if you don't already have one. Check your pressure at the same time each day for 2 weeks, morning and evening. Keep a written log. This gives you an accurate average and helps you see patterns. Second, perform the orthostatic blood pressure test I described earlier. Lying down for 5 minutes, check pressure, then stand and check immediately. If you have a drop of more than 20 points systolic or 10 points diastolic, write that down to discuss with your doctor. Third, assess your symptoms honestly. Are you experiencing dizziness when standing? Unexplained fatigue? Difficulty concentrating? These might be signs your blood pressure is too low, even if the numbers look fine. Fourth, schedule an appointment with your doctor specifically to discuss your blood pressure targets. Don't just accept a blanket statement that you need to be at 120/80. Ask what target is appropriate given your age, your other medical conditions, and your functional status. Bring your home blood pressure log. Bring your orthostatic measurements if you found a significant drop. Have an informed conversation. Fifth, if you're experiencing side effects from blood pressure medications, speak up. Don't suffer in silence. Many people assume that feeling dizzy or fatigued on medications is just something they have to live with. but often doses can be adjusted, medications can be changed, or targets can be modified to improve your quality of life while still providing cardiovascular protection. Here's what you now know that most people, including many healthcare providers, don't fully understand. Blood pressure targets should not be universal. A 45-year-old and an 85-year-old should not be held to the same standard. For older adults, especially those over 75, systolic blood pressure in the range of 130 to 145 is associated with the longest survival and best quality of life. Lower than 120 increases risk of falls, orthostatic hypotension, kidney injury, and possibly cognitive decline. Higher than 150 increases cardiovascular risk. The sweet spot is in the middle. You've learned that orthostatic hypotension, that drop in blood pressure when you stand, is often more dangerous than moderately elevated sitting blood pressure. You've learned how to test for it at home. You've learned the physiological reasons why seniors need different targets: arterial stiffness, slower baroreceptor responses, altered medication metabolism. Most importantly, you now have the language and the knowledge to have an informed conversation with your doctor. You're not just a passive recipient of medical advice. You're an informed participant in your own care. And that's empowering. You're now more informed about blood pressure management in older adults than probably 90% of people your age. You understand the nuance. You know that one size doesn't fit all. If this information gave you clarity, if it answered questions you've been wondering about, if it gave you confidence to advocate for yourself, then I've done my job. Drop a comment right now saying "informed." If you feel more equipped to discuss this with your doctor, share this video with friends or family members over 65 who might benefit from this information. Subscribe to this channel because my mission is bringing you research-based health information that's accessible, practical, and potentially life-changing. In my next video, I'm going to talk about the 3 supplements that research shows can actually support healthy blood pressure naturally, and the 2 popular supplements that are complete wastes of money. You're going to want to see that because the supplement industry is full of misleading claims. And I'm going to show you exactly what the evidence says. I'll see you there. This video is for educational and informational purposes only and is not intended as medical advice. Blood pressure management should be individualized based on your complete medical history, current health status, and other factors. Never adjust or discontinue medications without consulting your healthcare provider. The information presented is based on current research, but should not replace professional medical care. Always consult with a qualified healthcare provider before making changes to your treatment plan.